Have you ever wondered why some healthcare professionals they have this good character, they are excellent in patient care, they have this integrity in action, and most importantly, when they want to introduce themselves, they'll say, "Hello, my name is." It is called professionalism. A lot of people in their career, in their chosen profession, we all have this way we should behave, the ethical principles, the code of conduct, the policy of the company we work for. So today I want you to leave this page knowing about professionalism in nursing. Yeah, but generally, what does professionalism? Professionalism is your attitude, the way you behave, the way, your qualities, your values, or ethical conduct, policy in a work environment, or probably your chosen career or chosen field. So that's professionalism. Professionalism in nursing entails different things, but I will just pick on 5 things. Number one is your attitude and behavior. Your attitude and behavior is like you are compassionate towards your patients, care, you have respect, you have this empathy towards them, you are open, you're honest, you are accountable. Accountability, for example, is when you made a mistake, you report it and you learn from it. There's this what we call duty of conduct, where you are transparent, you are honest in everything you do. That's academic, and you portray a good behavior. Let people emulate you. That's being professional. Number two, we'll talk about the knowledge and competence. For you to portray that excellent skills, you need to improve on your clinical skills, you need to stay updated, you need to learn more from people, you need to be inquisitive, ask questions from people that are more experienced than you. You need to learn from your feedback. For instance, if they say you did something wrong, and you should up to it and learn from it. That's been number 3 is ethical practice and advocates. This with the NMC code, nice guidelines, your trust policy, this with dignity of the patient, the privacy of the patient, the confidentiality. There are a lot of things with this ethical practice. You might decide to advocate for your patients, you might decide to read their mental health rights. So a lot of things. For codes for NMC says prioritize people, preserve safety, practice effectively, promote trust and independence. So all this you must make sure you incorporate during your day-to-day activities at work. And number 4 is teamwork. We all know that a single person cannot treat a patient. We need different professionals from different fields to work together. So while you are treating a patient, you communicate with other professionals, different professionals that is into a patient care, because when you're treating a patient, we are looking at the holistic approach. So you alone cannot do that. You need different professionals. That's why you need to work in teams. So I believe in the word we, not I, because you can't do it alone, especially when you're working on the ward. No, you need different people. So while doing that, you communicate with people, your communication, be it verbal, written. And the 5th one is your appearance and communication. Do you know that there are some nurses that you see them wear these white trainers, but on the long run, the white has turned to brown. You must make sure that you wear the appropriate uniform. You'll make sure that you have your ID badge on. You'll make sure you pack. I don't leave my hair like this. I make sure I pack it above my shoulder. Yeah, I make sure I pack it off. You must dress neatly and tidy. You must make sure that you don't have this nail polish on. I'm a fan of polishing my nails, fixing and all that, but when I get into this profession, I realized that this is against the trust policy, and most importantly for IPC, infection prevention control, you shouldn't do this. Yeah, I know, especially if you are into direct patient care, like you come in contact with patients every day. You don't need this. You don't need this. Sometimes people forget to wash their hands. They forget to do this hand hygiene. They forget to use their sanitizer and just to eat with their hands. So most times the trust is against fixing, polishing, varnish and all that. So your appearance is important. Just make sure that every day, professionalism for me is just making every contact count. Have you heard that? For instance, if I want to meet a patient, maybe they've just been admitted on the ward, and prior to assessing the patient, I would have read about the patient's history, the background, just for me to have knowledge about the patient. So before that, I will knock on the patient, or probably before I moved, probably if the patient is in a bay, I will just make sure I knock, so that that's a bit of not just barging into their privacy just like that. So once I get there, I wash my hand, do this ING before you contact a patient or after contacting with the patient. So I do ING. If you need to put on your if I need to put on my PPE, I'll put it on. This involves the glove, the apron, and nose mask if that is necessary. But if it's not really compulsory at that period, so I wouldn't use that. I'll make sure if I'm fully dressed, like appropriate uniform, ID badge on, ear pack, everything neatly, and I'll make sure everything is intact. Now I will introduce myself to the patient. Hello, my name is Ifeoluwa. I would introduce my role to the patient, and for it, I'm a student nurse on the ward, and I'm under the supervision of a registered nurse. If you ask any questions I might not be able to answer, I will just redirect to the nurse in charge. That's how I will introduce myself. So I will ask the patient, what's your name? So if the patient answers, my name is Johnson. Okay, I'll say, oh fine, that's fine. Johnson, would you like me to call you Johnson, or what's your preferred name? Oh, you can call me John. So I can call you John. What's your preferred pronoun? Do you want me to refer to you as she, he, they? Oh, I love he. So that's it. So that means you've asked the patient their name, their preferred name, and their pronouns. So that's it. So henceforth, all through my assessments with the patient, or all through while the patient is on the ward, I will keep referring to him as John, not Johnson. So there, I will acknowledge the presence of John's family, and I will gain consent from John. John, do you want your wife to be here? Do you want her to have access to your care, your treatment? If he said yes, then I can go ahead and do my, while assessing Joy, I would tell him what I'm about to do. I would tell him the rationale, communicate with John in a clear, concise way, so that he will be able to understand, he will be able to ask questions. He can even paraphrase and reflect on everything I've said, or even he can summarize verbal communication method, the verbal communication method, the written communication method. Then I will tell John the importance of privacy, dignity. I will ask him if he wants me to open the window, if he wants me to shut the curtain, if he wants me to shut the door. That's prioritizing my patient, right? And there are a lot of things professionalism entails. There are a lot of things, but one thing I want you to know is you make every contact count. If you like more contents like this, don't forget to subscribe to this channel. This is JIABB'S World, free, and it can only get better. Thank you.